We've had difficulties all over the world with antibiotic-resistant TB. Very, very bad problem. And some of the mechanisms that we've developed to cure that problem are multiple drug regimens. So instead of something like just rifampin or just INH, and you probably don't know those drugs, but now they're combining different drugs. So they're using double drug therapy. Probably if you got a resistant case in the States, you'd probably get triple. But you know, double is better than nothing. Do you find that they're more, that the CDC and the government, are they more responsive to you now than they were last year when we were here?
Yeah.
Good.
For cases, it is free. Even for ART, it is free. No problem.
Good.
No provision of the drugs.
They're treating outpatient basis, right?
After four, yes, but 4 months intensive, right?
No, 2 months is
2 months
intensive,
intensive.
4 months is
Then when they go home, do you have a nurse to follow?
no.
No?
They have to come back here?
They have to come back because it is given directly on observation. This is DOTS, direct observation treatment. So they have to come daily for the first 2 months.
And you watch them take your
Yeah,
meds?
Yeah.
watch them take them.
Yeah.
Compliance is a problem, the
Yeah.
patient not taking the meds, so what they do is they bring the patient back here and literally watch them take the pill.
How come they're reluctant to take it?
A lot of times they run out of money to buy more medicine or to get access to it, or the pharmacy or local clinic won't have the medicine. So
You start to
Find
feel better.
patient blame,
You
yeah.
have
if they
to stop
start to
taking
feel
it.
better.
The first aid regimen is $120 a year. If they,
Doctors might treat would be hypertension, elevated serum cholesterol, maybe renal disease. Here they treat malaria, TB, HIV on a daily basis. You have a whole ward just for HIV.
All
Yeah, yeah.
infectious diseases, while we're treating chronic illness.
Yeah.
Major difference. Some of the issues that that Dr. Saya treats on a daily basis, I've only maybe read about in books and maybe seen a couple of times. I trained in Chicago at Cook County, which is an underdeveloped center, and but some of the disease entities that he sees here, you just don't. It's phenomenal.
Except with immigrants.
Yeah. Well, that's true. Okay.
Good? Yeah.
Wow, there.
Wow. Good job.
Maybe, can we just take a look at the operating room?
Yeah,
Okay.
And so yeah, where we sterile everything, they take and a lot of times just wash out the bloody bandages in the river and reuse them. So it's pretty sterile. These are all the surgical gowns. They wash them by hand and hang them out to dry on the line. If they have a rainy day, they don't do surgery because things won't dry and won't get washed. So